Bismillahirrahmanirrahim. Success is not final, failure is not fatal. It is the courage to continue that counts. Today, the topic of my presentation is acute diarrheal diseases. Learning outcomes are introduction of diarrhea, clinical types of diarrhea, epidemiological factors, prevention and treatment, global prevalence of diarrheal diseases. At the end of presentation, we'll be able to know about the definition and types of diarrhea, epidemiological factors, prevention and treatment, global and national level prevalence. Definition. Diarrhea is defined as the passage of loose, liquid or watery stools. These liquid stools are usually passed more than 3 times a day. However, it is the recent change in consistency and character of stool rather than the number of stools that is more important. Clinical types of diarrhea. 4 clinical types of diarrhea can be recognized: acute watery diarrhea, acute bloody diarrhea, persistent diarrhea, diarrhea due to malnutrition. Acute watery diarrhea. It lasts for several hours to days. The main danger is dehydration. Weight loss also occurs if the feeding is not continued. The pathogens that usually cause acute watery diarrhea include Vibrio cholerae, E. coli bacteria, rotavirus, and many others. Rotavirus was first discovered in 1973, has emerged as the leading cause of severe dehydrating diarrhea in children aged less than 5 years globally, with an estimated more than 25 million outpatient visits and more than 2 million hospitalizations attributed to rotavirus infection each year. In developing countries, 3/4 of children acquire their first episode of rotavirus diarrhea before the age of 12 months, whereas in developed countries, the first episode is frequently delayed until the age of 2 to 5 years. The incidence of rotavirus gastroenteritis typically peaks during the winter season. This slide shows the pathogenesis and transmission of rotavirus. It is a contagious virus that can cause gastroenteritis, inflammation of stomach and intestine. Infants and young children are most likely to get rotavirus disease. Complications are that patients can become severely dehydrated and needs to be hospitalized. Symptoms are severe watery diarrhea, vomiting, fever, abdominal pain. Transmission is through fecal oral route. It enters mouth by feces, contaminated hands, surfaces, or objects. About 2 million people are hospitalized annually worldwide. E. coli. Enterotoxigenic E. coli is an important cause of acute watery diarrhea in adults and children in developing countries, causing annually 280 to 400 million diarrheal episodes in children under 5 years of age, and an additional 100 million episodes in children aged 5 to 14 years. In adults, it causes substantial disease. It is also the most common cause of traveler's diarrhea, being responsible for 1/3 to 1/2 of all diarrheal episodes in travelers to Africa, Asia, and Latin America. This slide shows pathogenesis and transmission of E. coli. Although everyone has E. coli bacteria naturally in their intestine, people and animal can be infected with the strands of E. coli, which can sometimes be found in the undercooked food, contaminated water, and feces. Symptoms include diarrhea, abdominal pain, vomiting, fever. Toxins from harmful E. coli strands get into the bloodstream and damages blood vessels. Cholera. This shows the transmission and pathogenesis of cholera, acute diarrheal illness that is caused by infection of the intestine with the bacterium Vibrio cholerae. Symptoms are profuse watery diarrhea, rice water stools, vomiting, dehydration, circulatory collapse, shock. Incubation period is about 2 hours to 5 days. Annual infection rate is about 3 to 5 million. And bacteria exits body through feces. Feces can be contagious for up to 14 days. Acute bloody diarrhea. This is also called as dysentery. The main dangers are damage of the intestinal mucosa, sepsis, and malnutrition. Other complications include dehydration. It is marked by visible blood loss in the stool. The most common cause of bloody diarrhea is Shigella, which is an aerobic gram-negative rod non-motile bacterium. Shigella can be enterotoxic, neurotoxic, and cytotoxic. Acute diarrheal disease is because the enterotoxic response, which is while second stage dysentery is due to cytotoxic response. Well, this shows the transmission and pathogenesis of the organisms that cause bloody diarrhea. Persistent diarrhea, diarrhea that lasts for 14 days or longer. The main danger is malnutrition and serious non-intestinal infection. Dehydration may also occur. Persons with other illness such as AIDS are more likely to develop this disease. Exact cause is not well established. Diarrhea with severe malnutrition. This is the diarrhea with severe malnutrition, marasmus, and kwashiorkor. The main dangers are severe systemic infection, dehydration, heart failure, vitamin and mineral deficiencies. A reservoir of infection. For some enteric pathogens, men is the principal reservoir, and thus most transmission originates from human factors. Examples are enterotoxigenic E. coli, Shigella species, Vibrio cholerae, Giardia lamblia, and Entamoeba histolytica. For other enteric pathogens, animals are important reservoir and transmission originates from both human and animal feces. Examples are Campylobacter jejuni, Salmonella species, and Enterocolitica. Mode of transmission mostly transmitted through fecal oral route. Clinical features of the diarrhea caused by E. coli are watery stool, vomiting is common, dehydration is moderate to severe, fever often of moderate grade, mild abdominal pain. Because of rotavirus, the onset is insidious. Prodromal symptoms include fever, cough, vomiting that precedes diarrhea. Stools are watery, semi-liquid, color is greenish yellow, typically looks like yogurt mixed in water. Mild to moderate dehydration. Because of Shigella, frequent passage of scanty amount of stools, mostly mixed with blood and mucus, moderate to high-grade fever, severe abdominal cramps, tenesmus, usually no dehydration. Amoebiasis, offensive and bulky stools containing mostly mucus and sometimes blood. Lower abdominal cramp, mild grade fever, no dehydration. Epidemiological triad is agent factors transmit to host and host are contributing to environmental factors. Agent factors are infections causing diarrhea are mostly viruses, bacteria, and Giardia infections. Viruses are rotavirus, adenovirus, coronavirus, Norwalk group viruses, enteroviruses, and Entamoeba histolytica, cytomegalovirus. Bacterial infections are Campylobacter jejuni, enterotoxigenic E. coli, Shigella, Salmonella, Vibrio cholerae, Vibrio parahemolyticus, Bacillus cereus, Staphylococcus aureus, E. coli, Clostridium difficile, and many others. Giardia intestinalis, trichuriasis, intestinal worms. Host factors. Diarrhea is the most common in children, especially those between 6 months and 2 years. Incidence is highest in the age group 6 to 11 months when weaning occurs. Diarrhea is more common in persons with malnutrition. Malnutrition leads to infection and infection to diarrhea, which is a well-known vicious cycle. Poverty, prematurity, reduced gastric acidity, immunodeficiency, lack of personal and domestic hygiene, and incorrect feeding practices are all contributory factors. Environmental factors. Patterns of diarrhea occur in many geographical areas. In temperature climate, bacterial diarrhea occur more frequently during the warm season, whereas viral diarrhea, particularly diarrhea caused by rotavirus, peaks during the winter season. Prevention of diarrhea. Fluid replacement to prevent dehydration, zinc treatment, rotavirus and measles vaccination, promotion of early and exclusive breastfeeding and vitamin A supplementation, promotion of hand washing and soap, improved water supply quality and quantity, including treatment and safe storage of household water, community-wide sanitation promotion, fly control. Control of disease. The Diarrheal Diseases Control Program of WHO has since its inception in 1980 advocates severe measures to be implemented simultaneously. Components of diarrheal disease control programs, the interventive measures recommended by WHO may be classified as below. Short term and long term. Amongst short term, there is appropriate clinical management, and in the long term, there are better mother child healthcare practices, preventive strategies preventing diarrheal epidemics. Clinical management shows the ORS, intravenous rehydration, and antibiotic treatment. ORS, oral rehydration solution. It can be safely and successfully used in treating acute diarrhea due to all etiologies. The aim of oral fluid therapy is to prevent dehydration and reduce mortality etiologies in all age groups and in all countries. If the child is breastfed, nursing should be pursued during treatment with ORS solution. If the child wants to drink more ORS solution than the estimated amount and doesn't vomit, there can be no harm in feeding him and her more. Intravenous rehydration. Intravenous infusion is usually required only for the initial rehydration of severely dehydrated patients who are in shock or unable to drink. Such patients are best transferred to the nearest hospital or treatment center. The solutions recommended by the WHO for intravenous infusions are Ringer lactate solution, also called as Hartmann solution for injection, and diarrheal treatment solution, DTS, also recommended by WHO as an ideal polyelectrolyte solution for an intravenous infusion. It contains 1 liter sodium. It's the best commercially available solution. The recommended dose of the IV fluid to be given is 100 ml per kg. Maintenance therapy should be considered after rehydration therapy. These are the signs of dehydration in a child: sunken fontanelle, reduced level of consciousness, dry mucous membranes, tachypnea, reduced tissue turgor, oliguria, sudden weight loss, tachycardia, hypotension, peripheral vasoconstriction, sunken eyes, and tearless, reduced capillary refill time. Maintenance therapy. After the initial fluid and electrolyte deficit has been corrected, that is, after the correction of the signs of dehydration, the general principle is that oral fluid intake should equal the rate of continuing stool loss, which should be measured. Appropriate feeding. Normal food intake should be promoted as soon as the child, whatever its age, is able to eat. This is especially relevant for exclusively breastfed infants. Not only breast milk helps the infant to recover from an attack of diarrhea, both in terms of the nutrient it supplies and its rehydrating effects, but it helps to prevent further infection because it has protective properties. Chemotherapy. Antibiotics should be considered where the cause of diarrhea has been clearly identified as Shigella, typhoid, or cholera, or any bacterial infection. For diarrhea due to cholera, the drug of choice is doxycycline or tetracycline. For diarrhea due to Shigella, the drug of choice is ciprofloxacin, as Shigella is usually resistant to ampicillin and erythromycin and other combinations. Preventive measures. Improvement of food hygiene and environmental hygiene. These includes safe water, adequate sewage disposal, hand washing practices, clean utensils, avoidance of exposure of food to dust and dirt, fly control, washing of fruits and vegetables, etc. Avoidance of bottle feeding is most significant practice needed for the prevention of diarrhea. Boiling or filtering to be practiced for safe drinking water. Prevention of low birth weight and prematurity, exclusive breastfeeding, appropriate weaning practices, balanced diet, immunization are significant aspects of childcare. Zinc supplementation. It reduces the diarrheal episodes, duration, and severity. WHO and UNICEF recommends daily 10 milligram of zinc for infants under 6 months of age and 20 milligram for children older than 6 months for 10 to 14 days. Rotavirus vaccine. 2 live oral attenuated rotavirus vaccines were licensed in 2006, the monovalent human rotavirus vaccine and the pentavalent bovine human vaccine. The rotavirus vaccine is administered orally in a 2-dose schedule to infant of approximately 2 to 4 months of age. The first dose can already be administered at the age of 6 months and should be given no later than at the age of 12 weeks. The interval between the 2 doses should be at least 4 weeks. The 2-dose schedule should be completed by the age of 16 weeks and no less than by 24 weeks of age. Epidemiology, World Health Organization and UNICEF, there are about 2 billion cases of diarrheal disease worldwide every year. 1.9 million children younger than 5 years of age perish from diarrhea each year, mostly in developing countries. 18% of all deaths of children under the age of 5 means that more than 5,000 children are dying every day as a result of diarrheal diseases. Of all child deaths from diarrhea, 78% occur in African and Southeast Asian regions. Diarrhea is still a major killer of children under 5, although its toll has been dropped by a third over the past because of the morbidity on a worldwide scale. This shows that diarrhea accounts for about 26.5% of the mortality. This data from the UNICEF shows that in South Asia in 2007, approximately 8% under 5 years of age, children are dying because of diarrhea. This shows the trend in under 5 mortality rate in Pakistan, and it's constantly declining. World Health Organization is having many researches and ending preventable deaths from pneumonia and diarrhea by 2025 is an important component. Diarrhea and pneumonia and diarrhea together accounts for 29% of all child deaths globally, resulting in the death of more than 2 million children every year. The goal of the program is to reduce these mortality rates. This is a recent research on the rotavirus genotype in wastewater circulation from 2 major metropolitan cities of Pakistan. The aim of the study was to gauge the RVA contamination of major open sewage collecting streams and household water supplies in the 2 major metropolitan cities of Pakistan. Here the MCQs. A person is labeled to have diarrhea when he is having watery stools more than 3 times a day, normal consistency stool 5 to 6 times a day, alternating constipation or diarrhea every 7 days, stool that is hard to flush. Rice water diarrhea is caused by which of the following agent? D. Right answer. For controlling outbreak of cholera, following measures are recommended except C is right answer. Commonest factor causing diarrheal diseases in children and infants is recommended osmolarity of ORS by WHO for treating dehydration is C. Which is correct about rotavirus vaccination? It is live attenuated injectable vaccine. Most common cause of traveler's diarrhea is E. coli is the right answer. The best lab test for diagnosing diarrheal diseases causing antigen is blood examination, colonoscopic examination. In Pakistan, because of acute diarrhea, under 5 mortality rate is 6% and rising, 8% and declining. The main complication of dysentery is sepsis, dehydration, weight loss, ulcerative colitis. Main complication of dysentery is sepsis. It's the key. These are the references. Thank you.